Welcome back to Champions of Care, brought to you by Oakwood Healthcare. We're talking about total hip replacement. And with me in the studio is Dr. Eric Silberg. Dr. Silberg, right before the break, we were talking about the longevity of the procedure and how good we'll feel after the procedure. Can you tell us more about the readiness factor of hip surgery?
Well, before we decide to do the surgery, it's really important that we talk to our patients and understand their needs. Frequently, patients will come to the office and say that they feel fine, that they're not having that much pain. But when you ask them questions, are you bowling? Are you going shopping? Are you going for a walk with your husband or your wife? They'll frequently say they're not doing that. And so really the most important thing for patients is not to give up their lifestyle. When you give up your lifestyle, you will usually end up gaining some weight, maybe be a little bit depressed. And these are things that we need to pick up on so we can treat them and address it to help our patients. After surgery, we hope that the implant will last them the rest of their lives, and there's a good chance for a lot of our patients that will happen. As I mentioned before, about 90% can last 15 to 20 years, and we want them to return to their lifestyle. We want them to get back all the activities that they enjoy, and that's really why they're making the decision. It comes down to, am I happy with my lifestyle? Do I want to live like this? And if the answer is no, that's when we consider the hip replacement.
So let's talk about that period of time right after surgery. What is the recovery like?
Well, for each patient it's a little bit different. And I always tell the patients we're not in a rush, because a lot of times they want to grade themselves based on how quickly they do certain things. For the most part, a patient will walk with a walker for about a week, sometimes just a day or two, sometimes a little bit longer. They'll walk with a cane for about a week, and then they'll be walking without assisted devices at about 2 to 3 weeks. It generally takes about 6 weeks to be 80% recovered. At about 10 weeks, they're about 90% recovered. And the last 10% usually takes a few months to get all the swelling and achiness and so forth and to return to all your normal activities. And a lot of that is confidence. They have to get confident, again, in their hip, in their ability to be mobile.
Is it painful, the recovery process?
It's generally not. My hip patients are generally painful the first day or 2 or 3 after surgery, and after that they're sore, they're stiff, and they're a little bit painful, but they're usually not in a lot of discomfort. These patients are usually suffering so much before the operation that this is a relative release for them to have this done.
And we actually visited with a patient of yours before surgery and after surgery to see that whole process from before the surgery, making the decision, until after. Let's take a look and see how he's doing.
My name is Phillip Vasquez. I live in Dearborn Heights, Michigan. I have a plaque back there I got 2 weeks ago. I was in the Pharmacy Association for 50 years. Primarily, I'd go to the gym and keep active, and we've done a lot of traveling around the world. We have a map that all kind of pins on it where we've gone to Spain, we've gone to Japan, to China. I've had a hip problem for years, really. If I would make a sudden twist, it would hurt quite a bit. It would bother me even playing racquetball, so I had to watch my movement. And it's been the last year or so that I've had to avoid running, and I just couldn't get around as well. I couldn't do the bike as much. I couldn't walk as well at the gym. So, but I still do walk with a cane. I have started using a cane about maybe a month ago here, but it's not too difficult because I can still get around without it. So I refrain from using a cane because you always kind of have an ego type of thing. You're not used to it, but I do use it now. I spoke to Dr. Silberg in November, a very personal fellow. He talks to you, explains things to you, and my wife Alexandria had hip surgery 2 years ago this July, and it was quite successful. To me, it was just natural to go back to him because of her success. As a pharmacist, I've seen many patients come in that have had different surgeries. The success rate is quite high. and they do quite well. So that's another reason I know I should do well and will do well. I started therapy on a Monday, the day after I got home. And that Friday, I was doing well. He said, you can leave the walker go, which I didn't expect, but I felt like I could. The next Friday, I discarded the cane. And, you know, that's great, you know, 2 weeks in therapy and discarding the walker, the cane, and on my own. And as I said, a week after, I saw Dr. Silberg. He said I could drive in a week, and before the week was over, I began to drive. I felt so confident. Now I can bend my knee and get in without any problem. As far as tying my shoe, I can't quite do that. And I don't want to, because there is a 90-degree angle rule that I'm not sure what my limitations are. But otherwise, I'm doing quite well. As I say, I'm walking, I'm doing the bike, doing the treadmill. The doctor would tell me if I can do more, but otherwise I'm doing pretty much what I want to do. Well, my next goal, I believe, is to thank Dr. Silberg for what he's done. And I think he did an excellent job. I'm so glad I chose him. Well, he's got expertise, and together we've come a long way. He did what he had to do, and I've got the good results, so I'm happy with the results. I can't bounce with joy, but I do feel very good about it.
Dr. Silberg, Phillip Vasquez is an incredible guy. He's 82 years old. Now, what did he do right that the rest of us should follow so we have such great outcomes just a couple weeks after surgery as he did?
Well, Phillip really does everything well. First of all, he takes great care of himself. So if you notice, he's thin, he exercises, he watches what he eats. So when he goes into the operation, he's in pretty good shape. Even though he's 82, he's got a great spirit. And so for him, he expected to do well. And expectations are a huge part of surgery. If you can teach people what to expect and adjust their expectations, they generally do very well and they meet them or exceed them. So Phillip took good care of himself. He was diligent with his physical therapy after. He was careful in terms of listening to the precautions from the physical therapist, the occupational therapist, and myself, and he allowed himself to recover slowly, which is exactly what you need to do.
Dr. Silberg, I know there's someone watching right now who maybe hasn't taken as good care of themselves or isn't as athletic as Mr. Vasquez is, and they're still watching with that terrible hip pain. What would you say to them right now to get them to do something about that hip pain?
Well, people really have to look in the mirror and ask themselves, do I want to live like this? Do I want to live with pain, unable to sleep through the night, unable to go out of the house and go for a walk and be active with my family? Because once people realize the type of lifestyle they're living, they usually make their own decisions. I'm very careful never to push a patient or encourage a patient too strongly. The decision has to come from them. I educate, I help guide them, but I never push them into the surgery. They have to look inside themselves and say, I want to make a change. And generally speaking, when they realize what they're giving up, sometimes you have to show them what they've been giving up, they will usually make that decision. Fortunately, the hip replacement patients are really my happiest patients. I do shoulder surgery, knee surgery, and hip replacements, and the hip replacements patients really do well.
Dr. Silberg, I hear from so many patients who say, if I'd have known I'd have felt this good, I would have done it a whole lot sooner. Thank you so much for being with us today and teaching us all a lot more about hip replacement.
Thank you for having me.
My thanks too to Dr. David Siraz and the entire Joint Class 101 team. We've been talking about hip pain today, and if you'd like to learn more about the causes of hip pain and all of the different treatment options, please take advantage of our free class, the Oakwood Healthcare Joint Class 101. It's offered several times a month at a variety of locations, and it's free. Check it out on oakwood.org or call us at 1-800-543-WELL. Thanks so much for being with us today on Champions of Care. Be well.